Good morning, everyone. It's Dr. Hodges. I am just on my morning walk. I feel like I haven't made one of these videos in a while. Probably because I haven't made one of these videos in a while. My husband is off visiting his mom in Houston. I just dropped Margie off. I don't have to be in clinic for a while, so I am making the most of my time and going for a walk. And it's a little chilly. However, whenever I went to one of my bariatric conferences, I was eating lunch and I sat next to this gentleman up at the bar where they were having, where I was eating my burger. It was a turkey burger. And he was a PhD and he was actually presenting a paper on how whenever you work out in, when it's colder, it helps you to develop more or have a transition more of your fat to brown fat, which has a higher metabolic activity. So in essence, he said, if you're gonna work out, you don't have to get all bundled up if it's chilly outside because it actually can help your metabolism. That's the long and short of it. So that's your first little tip of the day. But what I really wanted to talk about is carbohydrates, foe or friend. I have a lot of patients that ask me, can they eat carbohydrates? Can they not? And I think it's also very confusing in literature and in social media, online. There's just so much different conflicting evidence. And I think it makes it very difficult for people to decide how much carbohydrate they should or should not eat, how much fat, how much protein. But for the most part right now, I just want to give you some little pointers on carbohydrate. And the reality is that there's nothing inherently wrong with carbohydrates. They are a very efficient way for your body to break down and release energy. It's actually the easiest way for your body. And so that's part of the reason why when we're in a very stressful situation, our bodies have been fine-tuned to have cravings for sugar, because that when you take it in, that's the easiest way that your body can break something down so it can get a big burst of energy. So that's just how God made us. So so inherently there's nothing really wrong with a carbohydrate. But when can carbs go wrong? So, I think one of the main premises about carbohydrates that I want you guys to know is, especially if you have a malabsorptive procedure, is that when you're eating a simple carbohydrate, and a simple carbohydrate would be like a simple sugar. So it could be fruit, like a citrus fruit, the sugars that are in like in an orange or a pineapple. It could be like we were making cookies the other night and Margie took a big old scoop of frosting. So you eat frosting, all that sugar that you put in your sweet tea. So simple sugars, not complex carbohydrates like a piece of bread, but some of these simple sugars. Your mouth has an enzyme called amylase. And amylase is the little enzyme that helps to begin to break down sugars. So digestion takes place in your mouth. The lining of your mouth and the lining of your small bowel, they all have this enzyme. And so think about whenever you suck on a lollipop, when you're licking on it, it dissolves. Or that's also why they have sugar-free gum. You're chewing on your gum, the sugars that are in the gum, the lining of your mouth is going to absorb 100% of that sugar, okay? That's where absorption is beginning to take place. Your mouth chews it up. Your mouth starts to dissolve and break down and absorb simple sugars. The esophagus is just like a food chute to bring it down to your stomach. Your stomach is really like, kind of like a holding bag, a holding pattern. And then it begins digestion of bigger molecules, and then it's the small bowel that will finish digestion. So if you are someone that's undergone a gastric bypass or a duodenal switch or a revision of your bypass, you might kind of think you're home free. You're like, you know what? I have that restriction. My stomach is small. Go me. But I also have that small bowel rearrangement, so I'm just not absorbing everything. And that is partly true. However, What you are absorbing, probably 100% of, is going to be a simple sugar. It does not matter that I have rearranged things. For instance, if you have a duodenal switch, it doesn't matter if your common channel is 100 centimeters. That's only like 2 to 3 feet. If you kind of do the conversion. It doesn't matter if you have just a short amount of bowel left to actively absorb big molecules. The minute that sugar gum went in your mouth, or the minute that you took a sip of that sweet tea, all the digestion and therefore absorption of those simple sugars began in your mouth. And that is why whenever you see people that have had surgeries, like an old bypass, or a new bypass for that reason, if you've ever seen someone, they've had a duodenal switch or a mini bypass or any of these malabsorptive procedures, and you see over time they've begun to have a little bit of weight regain, you need to look to see what their diet is. I suspect a component of their diet is going to be an increase in the amount of some of the simple sugars that they're taking in, because they're taking in 100% of those sugars. Now, then people will ask, why aren't you getting dumping syndrome? The answer is they probably are, or maybe they're just taking it in such small quantities that it's not enough to elicit a big rise in their insulin. They're just doing little bits over time. I know I've done a video on this before in the past, where the most common ways where I see people to regain their weight is if they drink their calories, sweet tea, if they graze throughout the day, or if they crunch on a bunch of crunchy snack foods. So when you're looking at your carbohydrates, I really encourage you to, number one, try to limit them if you can. And the only reason why is, number one, it could induce dumping syndrome. But then number two, you need to know that depending on the type of carbohydrate that it is, you may be absorbing 100% of that. And what you want to do is set yourself up for success. You don't want to set yourself up for failure. Now, does that mean you can never have a Hershey's Kiss? Absolutely not. It doesn't mean that at all. However, it's probably best that you don't keep a little bowl right out in the living room, where every time you kind of walk by, especially if you're working from home right now, that you go and you have a little Hershey's Kiss. Because that over time, it's going to start to work against you, because again, you are going to absorb 100% of that. Okay, so does that kind of help you guys? Once I had really started looking into digestion and also looking at what are some of the behaviors that people have, I really was able to finally see that connection, and I was really happy to start being able to share that with my friends. So the take home is, there's nothing inherently wrong with a carbohydrate. We need carbohydrate, fat, and protein in our diet. That is just how we were made. However, when it comes to simple carbohydrates, they certainly can work against you and your weight loss. So use those sparingly. I hope that this has helped, and please share this with your friends.